the thyroid gland, which is a small butterfly-shaped gland in the front of our neck, makes a hormone called thyroid hormone that's essential for our general well-being, metabolism, controls virtually every organ system in the body. It can malfunction either to make too much thyroid hormone, we call that hyperthyroidism, but much more commonly, it can become underactive, and that's a condition called hypothyroidism. The level of thyroid hormone in our body decreases, and that eventually has effects on everything from our brain to our weight, our metabolism, and all other bodily functions. We certainly know it affects women more than men. About 80% of all thyroid conditions occur in women. We do not understand fully why that might be, but it's well established. We know particularly hypothyroidism tends to become more prominent as we get older, so that it's much more common in someone in their 50s, 60s, 70s than early in life. Hypothyroidism also affects many other organ systems. It affects the heart and can slow down the heart rate. It affects the heart in that it has an effect on our cholesterol metabolism. Enzymes in our body that metabolize cholesterol are abnormal, and cholesterol levels build up to higher levels in hypothyroidism, and this can increase the risk of cardiovascular disease and cardiovascular events. Hypothyroidism can affect the brain. We don't tend to think quite as clearly if our thyroid is underactive. It can affect the intestinal system. The GI tract slows down, and so it may lead to constipation or less frequent bowel movements. Hypothyroidism in premenopausal women can affect their menstrual cycle, and it can affect fertility. And there are other systems as well that can affect muscle strength. You get weaker muscles, you get tired more easily. All of these are symptoms of hypothyroidism. There is a group of women, about 10% of women, who are at risk of an asymptomatic thyroid condition becoming symptomatic in their early adult years due to pregnancy. It's called, it occurs in pregnancy and postpartum, and it's been well studied. We know that that cohort of women, when they get pregnant, some of them are going to have a thyroid disorder and become hypothyroid during pregnancy, and some of them, after they deliver, are going to develop a thyroid disorder during the first year called thyroiditis. Any young woman who is suspected of having a thyroid disorder should have at least a thyroid antibody tested, and if she has Hashimoto's thyroiditis, then she should be advised that before getting pregnant, she should have her TSH levels checked, and she should be monitored throughout pregnancy and through at least 6 to 9 months postpartum, because abnormalities of the thyroid can develop during any of that period of time, and sometimes it can be quite symptomatic. When we first started studying this back in the early 1980s, we were finding that a number of women who were becoming very tired, fatigued, lack of energy 3 to 4 months after having a baby were just told, oh, you've got a new baby, what do you expect? Go home. And in fact, some of these women had severe hypothyroidism, and it was as a result of those studies that for the next 30 years we've learned a lot about thyroid disease during pregnancy and postpartum. And so I start telling women, even when they're teenage girls, start educating them if they've got a thyroid condition that they need to be followed, because that's a very reproducible group of patients who would benefit from proactive monitoring during their reproductive life. If they become hypothyroid during pregnancy, they definitely need to be treated throughout pregnancy, because untreated hypothyroidism affects both fetal development and maternal health during pregnancy. We follow these women very carefully. If the hypothyroidism or hyperthyroidism develops postpartum, the hyperthyroidism usually resolves quickly and doesn't require treatment. But because it can often go into hypothyroidism, which may last for 6 to 12 months, we often will treat these women unless it's very mild. Many of these women, after a year of therapy, can stop the therapy and their thyroid recovers. Now, they still have the underlying thyroiditis. If they get pregnant again, they will have a very high likelihood of developing an underactive thyroid again. So we always caution women who've had it once that doesn't matter if it's 3 years or 5 years later. If you have another baby, you're probably going to need thyroid medication again. And since you know about it ahead of time, you can usually treat them before they even become symptomatic.